The KCUCS has defined 6 specific steps for your success for the knee-chest adjustment. The 4th one is called the roll-in. The roll-in really begins with the hand being in the proper position. First thing we do is take our hands just like this, open it up like this, and you'll see it's flat across the bottom. I pull it away. Now actually we're going to have some bending in this position. It's very important when we're doing the roll-in that we have a nice indentation in here. We need a really nice little valley in there, because when your hand comes out flat, that's going to change the position when you do the roll-in, and it's going to be a little more loose. It's not going to be as tight. In anything in the knee-chest adjustment that creates a loose fit that's not really tight and bolting down very well is going to cause jarring in the adjustment. This is one of the keys of having a smooth adjustment. The next thing we want to pay attention to is really the angle of the wrist, and this is probably one of the #1 things I see beginners or people who have less experience doing the knee-chest adjustment. This is one of the things I see the mistake in. When they roll in, they'll roll in with a flat wrist. If your wrist is not cocked up in this way, it changes what's going on at the hypothenar eminence, and this is where our contact point is. When you flatten that down, it changes the mechanics so we cannot get a nice, clean roll-in with a tight set. The next thing we're going to look at is the elbow. The elbow is going to be at 155 degrees when we roll in. When we roll in, we do not roll in with the wrist, we do not roll in with the elbow, we roll in with the shoulder. For step 4, remember, we need a hand position proper, we need a nice cocked wrist, and we need the elbow to be at 155. When we make this step, we are not going to use the wrist and we're not going to use the elbow, but we're going to come through the shoulder in order to make the roll-in. And when you do make the roll-in, the hypothenar eminence, which is your contact point, should be contacting what your tissue pull, step 3, has already achieved. And if you will, it is part 2 of the tissue pull. You're going to pull more tissue with this without exerting more pressure on the contact point. It's just a matter of tightening down that contact point between your hand and the patient's contact. Let's demonstrate. Going to come in just like this, and we're going to pull in just like this, and at the end my elbow should be pointed at 10 o'clock. My thumb should be there on the spinous process, and I should have a nice tight grip on this contact without exerting more force in the procedure. For step 4, the roll-in really is a scoop. We're scooping more tissue. As we said, it's tissue pull part 2, and it's very important that this is cocked. That's very important that your thumb's down the spinous process. But the main point I want to get from this view is that we need to get a scoop. We're not just simply placing it down, we're scooping, because that helps tighten down the contact. And the tighter the contact is, the smoother and the more controlled the set will be. The more controlled the set will be, the longer that the lines will stay straight and the healthier the people will get. Okay, this has been step 4 of the 6-step process to the knee, chest, upper cervical adjustment as defined by the KCUCS. I'm going to encourage you to take out a Saturday, June 30th, and join us in Atlanta, Georgia to get professional analysis of your adjusting skill. I will tell you, it will increase your patient results.